Perfect.
Got it.
Okay. Audio, everything's still good? Everybody good? Good?
Everybody's good.
Perfect. All right. So, it's me. I'm first. I'm first. Okay. So, welcome everybody. Voz Divisiones pop-up episode. Just, quick random surprise episode. I'm really excited to get into this because it's like now we're starting to do some work and we're extending our mission and our cause beyond the season. And I'm really excited to talk with this panel, with this group of people and the amazing work, hear more about the amazing work they're doing. So thank y'all. Thank you, everybody who's tuning in. Now I want to hand it over to the one who brought us all together.
Buenos días, Bobby. Gracias. Gracias por la invitación.
By the way, I'm sorry. I forgot. Carmen Robles. I was like, I didn't look at my script. Carmen Robles. I just want to say thank you so much.
Hi, Dr. Colon.
I was gonna make you introduce your own name. Sorry about that.
Hey, Papi, the only thing my daddy left me was my name. So I'm happy to. Pero Bobby, I want to thank you for inviting me to your casa. This is extraordinary for me because I feel that we're expanding out to our urban communities and our suburbs and our rural communities. And so to be here with you on your show, taking your time for me to meet your guests or your audience that is always catching your show because your show is so powerful and it talks about the truth. So if I may, I'd like to welcome our guests, and I want to give a special shout out to Dr. Hector Colon-Rivera, who is my mentor, my guide, and working on opioids. He's with ORN, which is the Opioid Response Network that comes out of the feds, and they're trying to get to our communities and trying to get us to know what's happening and how they can help us save lives and give education. Dr. Colon was brought to us by Kevin Spading from the Metropolitan State University. And so I don't think they've seen each other for a while. And so I'm so happy to bring them together. And of course, we've got Roy Magnuson. He's with the Sheriff's Office, Ramsey County Sheriff's Office. And our Sheriff, Bob Fletcher, couldn't join us. He's out there, doing stuff. But he's very, very supportive, wanted to say hello to Dr. Colon. And he's here by way of Roy Magnuson. Suzanne Marie is my right-hand researcher. She's in Wisconsin with the pandemic, and so she's got nothing else to do but research. And so I wanted this team to meet you, Bobby, and to meet your team. I've got a quick introduction here on Bobby Martinez, who's an accomplished visual artist and whose work explores the systemic effects of socioeconomics, race, criminal justice, mental health, and substance use disorders, which is what we're about. And most recently on opioids. And so Voces en Visiones is a series of discussions exploring Chicanx issues and perspectives. Most importantly, that what they're doing now is sharing a personal story. It's called Pancho's Journey. And I certainly want to give a shout out to Pancho and to thank him for his courage, to thank him for his leadership. It's not easy, and they're in a small town in Texas that Bobby will talk about. But I do want to mention that Pancho's Journey is a new series dedicated to following Pancho, real life stuff on his path through recovery. This is September is the month of National Recovery. And so it's like such just a perfect time to get into his story and to let him know he's not alone. Minnesota has his back. Bobby has a heck of a team. He's got Miguel Valdez, who's assisting community members and researchers in the planning and execution of community engaged research and research related events. by building sustainable relationships between community members and Mayo Clinic researchers. So that's for me, it's a super important part because that's what we need. We need research, we need data, we need information. A valued member of his team is Alexa Rivera, who's Bobby's cousin and who's played a major role in the webcast and the shows. She's a college graduate and she's breaking barriers left and right. And she's one of the reasons Voces and Visiones will have a true impact on the world, as evidenced by Bobby's background. So she's not only an inspiration for those from Robstown, Texas, a town of, I think, 15,000 people, but she's also an inspiration for those around the world who take a stand against the limitations set by cerebral palsy. And so, Bobby, this is mi casa. This is my team, my family. You know, Latinos, you invite one person to your house and everybody shows up. And so I like to turn the show over to you and so that you can welcome our guests and especially Dr. Colon, who's leading Minnesota into this fight against opioids. And let me say hi to DJ Angel, who's our media connection, and his radio station is the voice of health, giving PSAs. We're going to be doing more interviews so that we can actually talk to people in their homes. But without further ado, with all my heart, I'd like to say hello to Dr. Hector, welcome you to Rochester. Bobby's in Rochester, Minnesota. And to thank you for being with us again and again and again and again and again. I know you're super busy like everyone is. You're a physician at the front lines, an essential worker. And Bobby, I give you my familia. Take her away.
Thank you. Thank you so much. So first of all, shout out Pancho, Alexis, Miguel, everybody for helping behind the scenes. Also, Pancho doing your thing. I told you we were gonna be out here. So real quick, I want to just give a real quick backstory on why I'm here today. You know, how we ended up at this point and why I'm excited about this conversation. I grew up again in Robstown, Texas, aka Rove, like born and raised. And I grew up, through ups and downs, through the usual like delinquent teenage thing, and experienced a lot of things in my own environment. But something that's still prevalent to this day has been, the issue, and in a lot of our communities, is the issue of opiate addiction, opioids, any kind of addictions, substance abuse. Yeah. And, I still have loved ones that still battle with that to this day. And it's something that's really important to me. I lost 5 people that were really close to me in this year alone to overdoses. So, yeah, so this is something that's really, really close to me. And all this stems from, I had an episode, I think it was episode 3, The Addicted and the Affected. And, we had a doctor on it, and after we had our conversations, I mean, we had private messages from people that said, how impactful the episode was, and how much it changed some of their lives and their perspectives regarding addiction and everything else. So it's something that, that literally like is a part of me, this mission in particular, this topic, this issue. So I'm excited to know more about you all, though, and the work that y'all are doing and why you do the work that you do. So we'll take it away. We'll start it off with Dr. Hector Colon. Thank you again for joining us to be here in this conversation. I'm excited to hear more about your work.
Of course, Mo, thank you for the invitation, and thank you, Carmen, as always, and the team, La Familia. So we just starting to recognize how addiction or substance use disorder affect, not only the person that's using, but also the communities, the society, and how, interlock or combine all the disorders are, right? So that depression, anxiety, we know most of those conditions precede the substance use. And in the past, we thought that there were like 2 heads from different bodies. And now we're seeing more how, the integrated care services, how some states are joining budgets, because in some states those budgets are separated, like where I am right now in Pennsylvania. And that's the way we used to think, right? The conservative politician used to think that these things should not be together. Now we're learning more how, this affect not only the person using, but also family, community, society, economics, education, transportation, the entire universe. I think COVID, one of the things that COVID brought to us, we talk about negative things of COVID, but there are a few things positive about COVID, that they brought the social determinants of health to the surface. We're talking more about it. We know that we were not ready for a pandemic like this. The health system wasn't ready. The politics wasn't ready. And now we are kind of rethinking the way we do things. And that includes rethinking how we treat our patients, how we prepare ourselves for a pandemic, but also the epidemic going at the same time that the pandemic is going, right? We're still dealing with the opioid epidemic. I'm glad the Opioid Response Network is expanding their services outside opioids. We know people smoke, we know people drink, we know people are mixing all the medication now with the meth increasing. We have stimulants going up, people showing up with methamphetamines, overdoses, intoxication, presenting as psychotic. When it's not really primary psychosis, it's secondary psychosis induced by. So we need to be really careful with those presentations, because diagnosing someone with schizophrenia it change their life, right? When we need to treat for the substance they're using, not for schizophrenia, because they are not schizophrenic. Most of the cases that they present intoxicated to the ER, and that creates another situation, right? That's 18 years old, show up to the ER, started on antipsychotic, diagnosed with psychosis, sent it to the inpatient unit. You change that kid's life forever, right? So we need to change that mentality. We need to educate our providers. We need to educate the community. Forget it, drugs are bad for you, yes, but it goes more than that, right? It's more about education. We need to prevent. We don't talk enough about prevention. We don't talk enough about school programs, right? Drugs are bad, yes, but why? What's this 10 years, 5 years, 6 months, 1 month effect of using that? Why smoking is bad for you? It took us like, I don't know, 60, 70 years to know that it gives you cancer, right? When we still smoking. So those things, yes, I think we're going super baby steps here. We have seen a lot of changes lately, but still, we are not nonprofit, private, the state, federal government is not on the same page. I think that's the message we need to, take, that we should be on the same page. I don't know what else we're waiting for. People are continuing to die. So, if dying is not enough, we need to keep having this conversation to, promote awareness and prevention.
Oh, that's great. Yeah, I definitely want to come back and unpack some of that too. So I want to go and go down the line and get an intro into Roy Magnuson. Hi, Roy. Could you tell us more about the work that you do as well, and what your mission is?
Yeah, I'm working for the Ramsey County Sheriff's Office. My title is Public Information Officer, but I do at least 70% of my stuff is community engagement. And our mission starts from the top. The sheriff is hands-on committed to the fact that he personally lost a 26-year-old son who had been clean for 7 years to a birthday party overdose where friends, this was just before Narcan, friends panicked and abandoned him. And when he finally got help, it was too late. But he also recognizes that criminalization is pretty much a path that has been shown not to work, and that being proactive, doing prevention, being involved rather than waiting to intervention is a much more effective tactic. And we have, obviously, when people show up in the Ramsey County Jail, we have the ability to have a moment of detoxification. But what we need to do is figure out How Before, which is why we're in the schools. How Before, which is why we're doing things with Recovery Cafe Frogtown, which is part of the National Recovery Cafe Network, which is why we have Carmen Moreno, one of our outreach officers, starting to do. We're going to devote a segment of her time to be doing prevention, intervention, community outreach. We work with a group that does things in our Ramsey County high schools, and they are enthusiastic, they are gifted. Carmen Robles will also argue that they are not necessarily good at getting into all communities, but we're trying to help to make them a little bit more successful. And in fairness to them, they're taking steps and learning, and everybody that's done things before needs to help. And what we want to do is help people have successful lives, not criminalize, not shame, not judge, and absolutely let's make sure that someday we say we've stopped seeing suicides and overdoses that are connected to all the ripple effects. And that's a nutshell. There's more that goes on, but that's what we're trying to do.
Wow. Yeah, that's so important. The decriminalization too. That's like such a big factor. That yeah. We'll get. I just want to dive directly into it. But we'll keep going with the intros. So next up, Kevin. Kevin, I don't have your last name on here, but with Metro State University, can you tell us a little bit more about you, yourself, and what your work is?
Sure, thank you. And thank you so much for doing this. And Dr. Colona, it's great to see you again. I'm so glad you're spending time in Minnesota and being so helpful. So just as a little personal background, I'm originally from Fresno, California. And so for me, and my age, I kind of go back to some deep roots of activism in the Chicano movement, and that was my background. And from there, I taught, or I got my degrees in Spanish and counseling, and landed at the largest Spanish-speaking social service agency and became their director of chemical and mental health services, where for over 10 years worked in treatment, but then moved into prevention and managed millions of dollars of sometimes first ever initiatives, Chicano Latino resource centers, chronic homeless projects, adolescent and adult outpatient treatment. But this is all like for the Spanish speaker and their families. And so when you think about that and being in the Midwest, it was a pretty unique endeavor. Well, since that time, I have become the associate professor at Metropolitan State University, where we oversee both our undergraduate and our graduate programs. But I'll tell you simply, one of the main things I'm very, very interested in, and I saw it when I was a supervisor in the social service settings, we needed interns. We needed to build our workforce, our Spanish-speaking workforce. I realized we had very few licensed alcohol and drug counselors working in the state of Minnesota. That need continues today. And for a university such as Metropolitan State University, where our population, our student population is so diverse, it's like nearly 40% of the population. And with over more than 400 students in our undergraduate and graduate programs, we have an incredible opportunity to recruit, train, and prepare future licensed alcohol and drug counselors. But it doesn't stop there. The peer movement, I was helpful in writing the 245G, which is the state language for how to bill for services, how to expand the people who could be hired in treatment centers. So peers, case managers. We knew that this important work was underpaid, essentially. And we had to expand our capacity to those unique needs as well. But, within that effort, very few Spanish speakers in Minnesota today even know about those licensing opportunities and the ability to expand the capacity for agencies to do this work. I started back in 1994 with this work in the Spanish speaking community, and sadly there's not a lot of more capacity to do this. So just recently, and I'll end here, in 2021, one of the things that I was doing during my sabbatical was helping write grants for some first ever peer work. And over $500,000 was awarded, and specifically for peer work. And also one of the things that you'll hear about, and I promise I'll stop. One of the biggest federal efforts that's happening right now across this country is this CCBHC endeavor, which is basically community behavioral health clinics. And Minnesota one of the Spanish-speaking agencies in Minnesota just was awarded that grant. So there's some incredible aligning going on right now. And we need to share these resources, and we need to go back to the main goal, build the workforce for Spanish speakers to expand our capacity to do this undergraduate and graduate licensure work.
Oh, that's really great. I'm starting to see like an entire infrastructure. So, okay. And next up we have Angel. Is it Angel? Hey, Angel, you wanna tell us a little bit more about what you do and the work that you have and the mission that you're on?
Of course. Thank you for having me on this team. And Carmen, like always, gracias. Dios te bendiga por todo lo que haces. Over 25 years of experience working with the community on basically marketing. I'm the one who get on stage and introduce great musicians. I'm the one who talk to a lot of people and answer a lot of questions. So now we created this internet radio station. And when I was looking at Carmen's project, I like perfect for the radio station. ¿Por qué? Because these Latinos that listen to the radio, they need to know what's going on too. And our mission is to translate all this kind of information in Espanol to get to them, for them to have the ability to get some help if they need to. I did it for the Minnesota Twins and also work referring events through the Minnesota Twins here of the Twin Cities. I've been doing that for over 10 years now. Great organization with Clues in St. Paul. I'm basically the one who put all those festivals together, give them all the logistics where everything should go. I've been working with the Latino Peace Officer Association in St. Paul for now over 5 years and meeting a lot of people there. Mujeres Latinas event, and I'm talking about all the event, the Gala Tropical Radio Band, and we played commercials, we passed information. Now I'm working with the Food Group of Minnesota, and we're still delivering information to the community. With Carmen Robles and Associate, I think, ay Dios mío, the information that I'm getting and bringing that to every show that we do on the radio is great. Gala Tropical Radio is part of Noche de Gala Productions, and we are certified event festival management here on the Twin Cities. So all those festivals that you see, like Taste of Minnesota, Grand Old Days, I've been working very close to them. At the Cinco de Mayo for over 10 years, a lot of agencies do look for me to communicate information. And, Riverview Economic Development Association in St. Paul, we've been very close to them. Now they're creating a different agency here in South Minneapolis related to help the community again. So Gala Tropical Radio is here for not only for you guys to be la voz en español, but also to refer people. We get emails from people, hey, where I can get more information about this. So we refer people. And we do it with the heart, we do it with patience, and we do it in Espanol. We need to hit, I honestly think getting to the Spanish community and getting their trust and getting them more information is very important for this project. And I'm very glad to do it. And we're going to continue.
Oh, that's really, really great. So then I think, is that everybody? And then we bring it back to the one that brought us together. Carmen, do you want to
I'd like to
into...
introduce my colleague, Suzanne Marie. And if you could say hello to folks and tell them a little bit about you, that would be wonderful.
Yes, thank you, Carmen. It's I've been working with Carmen on the opioid situation since 2019. She invited me to the conference, the first conference, and I was just so impressed with, you know, her ability to bring specialists together, and I became very interested and realized what a problem this was in the Hispanic community. So I've been very you know, interested in doing whatever I can do to help her achieve, you know, the goals that she needs, that she really has wanted to achieve in reaching out to communities that are underrepresented and underserved. And I have to admit that prior to helping Carmen, I really had no idea that this community was so underserved in a way. So this is very important information to get out, just generally to the, of course, to the Hispanic population, but to other people also, this awareness. So I've been very committed and very interested in working with Carmen. And as I said, I've known Carmen for a long time. So, you know, I always enjoy working with her and enjoy her professionalism and, you know, intelligence and her ability just to reach people. I love you, Carmen. So yes, that's
Hey, this was unscripted, okay?
Right, yeah.
Thank you for those kind words. Well, as you know, Suzanne, it's bringing the right people together. And again, I cannot say more about ORN, the Opioid Response Network, and the real commitment to work with community, because many will say they do, yes, but then when you go after them, you know, where did they go? They disappeared. So for them to support my grassroots community work for 2 years, because it's going to be 2 years this month, yes, that Dr. Colon came and visited with us and shared his just that incredible passion that there is hope, that there's esperanza. That was the name of the conference, Esperanza para nuestra comunidad, hope for our community. And it's really difficult to hold on to hope when things are so hopeless, and you don't have people that look like us and sound like us, and
absolutely,
not only are bilingual but are bicultural, because you could speak Spanish, but if you're not into la cultura, then it's not. It takes longer for the message to go through, and at the death rates that we're having. I was going to have a colleague, I think she got caught up at school, who's with El Colegio, and Dr. Colon went and visited when he was here, when we had social gatherings, and went and talked to the kids there. And I'm still overwhelmed by their lack of enthusiasm for math and science, and you know, they want to be rappers and singers. And then when Dr. Colon just talked to them for, I think it was half an hour, maybe 40 minutes, the impact that was left, and how all the hands went up when he talked about, you know, who's going to be another doctor and who's going to be this. And so we've been trying to bring that back, but of course a pandemic came in the way. And so we're so honored to have him coming through to us virtually, as I'm sure his schedule is just insane. But through these past 2 years, we've been able to hold webinars and talk to decision makers, community people, people like this panel that have a passion and want to make a change. And so, Bobby, I think this was why I was so excited to meet you, because we met through an artist that helped us make our logo kids and an artist made our logo for opioids, Conversaciones de Salud. And with the guidance from Dr. Colon, the kids made a bilingual, bicultural PSA on a proper disposal of prescriptions. And so that's being circulated, and it's had a very powerful effect because it was created by kids. And so an artist introduced me to Bobby, who uses art as his tool to bring the conversation around, except he's way ahead of the game. Productions, yeah, and with Pancho. Hello again, Pancho. And so I'm excited because I was getting to the point, like, you know, what else can I do? It's not my field. I don't have any expertise. I can just bring stakeholders together. And I feel so confident that now Bobby joining the team can really help us get on the right track. And with Kevin saying somebody got money, who got money, Kevin?
Where is it at, Kevin? Where is it at?
You have to show us who got the money so we can go and seek support, because how can we get people cleaned up and want to start a new life if there's nothing for them? You know, we need to stimulate the economy, those peer mentors we spoke of earlier. How do we get someone like a Pancho to want to be that peer mentor and get that degree? And, you know, so for me, that's that prevention. I'm totally into prevention. It's so much easier than once you're in it and trying to clean it up. And so I think, Bobby, you've helped establish that, create that. And I also need more information to share with Dr. Hector and what's happening in Minnesota, and because he's just a well of information and contacts and data, and so how can we share, you know, that brilliance and the support from ORN while we have it. So I'm so happy. I hope that your audience would like to see more of this. Join us in our webcast and share their thoughts. You know, how can we help? How can these people who are in decision-making positions, who know the scope, the lay of the land, how can they help us? We're on the grassroots, and we're with Doña Petraca over at church and Don Juan over at the store, and so you know, how do we get our kids involved? We're cross-generational. We watch novela with our seniors, and you know, we listen to the music, and that's very important to our cultura to maintain that. And I think Radio Rey is an excellent example of that cross-generational, that the seniors and the kids, and having kids take on a role. You know, how do you want this message communicated? How do kids talk to kids? And then to have you know, these experts that we can tap into is very exciting. I think when we did the conference 2 years ago, it was the first Latino conference focusing on opioids across the nation. So I see what we do here as a model for our other Latinos who are in you know, all over the United States, Mexico, Puerto Rico. I mean, we can do this virtually with everybody, and opioids is affecting the world. So this ability to just, you know, get one chain link to another chain link, and then I think we'll be so strong and know where these resources are, where we can send people. I would love to have I've been asked to have a conversation with Dr. Hector and seniors, the families. They just want to talk to him, and they just want to, because Latinos are all about trust. You know, we trust the priest, we trust the doctor, we trust the teacher, and so to be able to have this bilingual, bicultural expert. And he's very humble, and he doesn't talk much about all his renowned achievements, but I sure as heck will. And and let him know how we so appreciate being the recipients of this knowledge here in Minnesota.
I just want to mention something that, something that we have learned with the COVID, and I know travel is not allowed, but because travel is not allowed, we have been getting more counsel from other states. So I've been in conversation with Wisconsin, Puerto Rico, even Virgin Islands. We were going to do a talk about mindfulness and motivational interviewing. So that happened online, meeting with some people in California. And I was going to say that this is something that, yes, we're talking about Minnesota here, but we are suffering. I mean, this conversation that I'm having with you guys, or you're having with me, I have it with my patients. You know, I start working at 6 a.m. I finish probably my last patients at about 7:30 p.m. I work weekends as well, and I cover different settings, right? Rehabs, telemedicine. I go to the inpatient unit, CEL, which is medical floors. I work a lot, but I also see a lot of patients, all ages, and that give me a different perspective, and I like that. But at the same time, I feel that, you know, COVID and seeing all that perspective, you know, we're not an island, right? There's no humans on island, and I think we are suffering in silence. And what I want to say is that, yes, we're working on these projects, but you know, there's so many people out there working these small projects. And if we learn something from COVID, I think we need to be working together, because you know, dying from an overdose is dying from an overdose, right? I mean, and everyone's different. Reasons for using are different. Reasons for feeling depressed are different. But dying from an overdose is dying from an overdose, and we need to stop that. I mean, that's the end. I feel, you know, having these conversations and COVID and technology now, I think has helped to, you know, tell stories. But what we do with those stories, that's what still can manage, right? What we're doing, we tell the story, and then what happened, and that's where we're missing the big piece, right? Capturing, and then what we do with all those stories. And I think if we're doing something today, I feel, you know, we need to work together on capturing all the stories. Maybe, you know, more action than research sometimes. I love research, don't get me wrong, but sometimes research tell you a part of it, right? Then we need the implementation. Who are the people that are in charge of that? We need to talk more with them. Who are the ones that change the rules, the guidelines, the law, right? We need to talk to them. So I think those pieces are missing, and we can tell stories forever, but it's not until we capture all that and the right people listen that we're not going to see a change. So I just wanted to add that to Carmen, you know, words.
No, that's
Yeah.
great, because I
Yeah.
oh, sorry, go ahead.
No, I echo what Dr. Hector is saying, and we've had webcasts with decision makers and those people that, you know, not just the stories, but the people that can actually bring action. And so that's where I go up against the wall, because you know, what is the next step, and how do we capture all of that? I think by having Kevin and Roy here, who are in those positions, is very valuable. And like typical Latinos that they are, deep down inside, they're humble, and you know, they want to make sure they're not stepping on toes. But I definitely agree, it comes from the top to the bottom, and so, you know, to have more of those discussions. I want to have a discussion with our Attorney General. He just settled Minnesota $50 million from the big pharma, and just have those conversations. You know, where do we go from there? How do we access that? How do we involve the kids? And like you said, we've got the stories, so, you know, and that's why I'm so happy to have you here, so you can tell us what to do with the stories, Dr. Hector.
Well, I think well that's one of the things too. Like I personally, what we bring to the table here with Voices and the work that I'm doing is, we started with arts as catalyst to dive into important topics around like affecting our community. So and again, it's because the people that I love, some people that are watching right now or that will watch later today, are going through addiction, leaving addiction, have loved ones. They lost loved ones. Like I said earlier, I lost 5 people this year to overdoses alone. Um, so this is something that's what I bring to the table is using arts as catalyst and using our platform as a way to, because we can get the information, the resources, and all that, but trying to get that to the people that need them, or having that connect, that conduit in the middle, that ambassador of information, or that medium. That's what we're offering with this platform. So I mean, we're always open to using this platform to directly engage the community, the audience, and the people that you're trying to reach. Also, building a team of doers, and using the people that are going through what they're going through, just like Pancho's journey. Pancho just after 17 years of being addicted to heroin, shooting up heroin. He's been clean for months, and then he started filming videos on Facebook. And he's a friend of mine. We had a falling out years ago, and then I saw videos of him like just trying to like motivate the people back and talk about sobriety. And I called him, and we made amends. And I was like, hey, how about you film yourself, or we put your videos on Voices as a platform, and you just start this thing where it's Pancho's journey, and it's public, so it's accountability and it's purpose. So it drives him to stay on that path, and it inspires others on what's possible. So that's what we're doing. That's just an example. So I mean, I'm open to a lot of things. Like even with Angel, I've done multiple festivals in here and in Texas. But using it for something like that we could like share these messages, like maybe have booths where we share resources, booths where at these festivals where like someone like Kevin can have a sign-up sheet for classes, or where we have the sheriff's department, having more information about decriminalization, and having that open conversation with someone who is addicted or someone who's going through stuff. So I feel like activating all these things in some kind of way is absolutely possible. Absolutely. And I look forward to conversations that are going to happen after this, because I want to hear more also about the Opiate Response Network, like what the network consists of too. Because like I said, I wake up every day like it's like a clock with my loved ones. Like this is something that I breathe. That this mission is very near and dear to me and to a lot of us. So I'm excited to see where this goes after this. So thank you all.
Muy bien.
So where are we at? We still got a few minutes. So do you want to Dr. Colon, do you want to like just give a quick overview of like what the components are of the Opiate Response Network?
Well, Opioid Response Network is an answer, right, to what was going on with the opioid epidemic. We know, it started back in the 90s, kind of escalated on 2006, 2007, 2013. We have the spike of overdoses. So it's I would say it's a response, sometimes maybe a delayed response to what was going on. We waited a long time, but it's a response. And I think it's been adding components to it, right? We started with opioids. They added the stimulant. There's some conversation to expand it to mental health in general, because again, we're seeing how those components interact with each other. It's kind of hard to separate them. So it's a project in process, and it's been renewed multiple times through the years, and because it's national, right? I mean, I don't know how many TA console, technical assistance console we have had, but it's been 100,000 through the for the past probably 3 years that we've been active. And again, I cover Pennsylvania, and also national, but also Puerto Rico and the Virgin Islands as a senior advisor for Virgin Islands and Puerto Rico. And we see how this has happened anywhere. Every corner of the nation has suffered from the opioid epidemic. So it's a working process. There's a lot of people working on it. It's completely free. Anyone can put a console for it. If you go to the Opioid Response Network website, you put a console. If you're a solo practitioner, if you're a teacher somewhere in the rural areas, if you want to learn how to open your buprenorphine clinic, or you need information about a drug, right, that your community is suffering from. We're working on the Spanish, translations of some of the things, and not only a translation, but also how to give the message in a cultural competence or humble way to those communities. And it's not only the Opioid Response Network. I mean, other organizations like the American Psychiatric Association, for example, I got an email a few days ago about they wanted to translate their website in Spanish. So again, we're knocking doors. It's a national effort. We have to do this. I mean, we are super, 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 super late, but it's not, we still have time, and we want to get that time, and we want to save as many people as we can. And there's no better time than now. I mean, COVID it's still happening. So it's teaching us a lot of things. Mr. Freud dead and Joy, it's like all this racism that we have seen in the nation. Our politicians have taught us, how not to be. So a lot happening, and we're learning from these experiences. And I hope, our kids, our adolescents are also listening to the news and what's going on in their communities. It's as simple as opening the door of your backyard or opening the door of your entrance to know what's going on in your community. Calling a friend that has suffered from mental illness, or a family member have died from an overdose, or not even an overdose, right? Because drugs bring a lot of violence to the community. They have been killed, gun violence, gangs. Have a lot of patients that are part of gangs and they want to get out. They get out, and it's really hard to get out of the gangs. So it's not just the drugs, right? I know Roy mentioned his son and how he died. I mean, he didn't want to die. I mean, it was something they left him behind. I mean, and probably they were afraid. They didn't understand what was going on. So that's education. I mean, probably their friends had the prevention information and the education. Roy's son couldn't be alive. So it's all that. It's not only the person that is suffering from the substance use disorder. It's the community, it's the friends, it's the family members.
Oh, that's great. That's yeah, it's the infrastructure, the entire system. So many components that play a role in all of this. And I like the fact that you talked about information. Like, if they were informed, it would be so much different. And again, I'm really looking forward to diving into more of all of this, like every person, and diving into the website, diving into everything that's going on, because I feel like all the pieces are in play. Like, everything's in place already. It's just bring them together.
The puzzle.
Yeah.
Something that really strikes me is I believe that you may very well have the ingredients for becoming a recovery community organization, which is another kind of action group which captures the stories. It's a place where people bring their stories, and it's also where immediately you see people getting involved in prevention, because it's because of that passion, often from that tragedy, that people will then bring forward the full story, and where we as a society, where we as a community, where we as a school district, where we as a county, where we could be creating a different story, where we can be creating what's called norms, positive norms that contribute to the healthy development of young people and their upbringing. So something else just to kind of ponder is is what's happening with this National Recovery Community Organization movement, and could your group be the first group in Minnesota that actually kind of becomes the organized Spanish at its heart group that really cares for the community and doesn't have to wait for, you know, this process to kind of inform us of what's going on. We'll just get involved. There are mentors. There are other groups, I know them personally, who would say, let's help you kind of get on this train. And there's a funding train to that too. I mentioned the funding that I helped at Clues get, which was a peer process. Well, peers are your first, after you come to a recovery community organization or coalition meeting, you're going to want to learn how to maybe even get hired in a treatment center after the right amount of sober time, and suddenly you'll be in the trenches paying it forward and getting paid. You know, and I happen to know that because I'm on the board of the Minnesota Certification Board, and we write those agreements for those recovery community organizations. So that's a certification process, which is an opportunity for employment in the field. But so do you sort of, it cascades. One door, as you said, opens to another door and to another door.
Oh, I love that. See, and I feel like, so like with Voices, the way we got here was my art career. I started as an artist, like 8th grade dropout. You know, I grew up as, you know, doing whatever I did. 8th grade dropout, realized I wanted to just refine myself as an artist, dumpster diving, my own career. Then I started doing public art, enriching the community. And then I did my own pop-up art shows, bringing people together, then festivals, bringing people, and then it grew. And then I did workshops and lectures to kids and students. So I brought all that together, brought it back to a movement down in my hometown where I painted a mural, did a festival.
It's working.
And then after that, we started Voices, which is
That's
like,
perfect.
you know, so I see like that's why I'm like talking with everybody today. I see all the components, like
Right.
putting together an event, like, oh, that can go there, that can go, oh, like I see it like clearly how it could click together. And like even the future of Voices right now, we're gonna go into Voices on the Road, where we extend the episodes and I go visit rehab centers, go visit the streets, go talk to addicts, go you know, talk to someone about integrative medicine, where we take it outside of the episode and actually do action. And that's just one example. So again, back to just everything playing a role. I'm excited about.
I would like to grow with you and do all that live, because we got the power to produce all this live from that location. So keep that in mind. You know, I can translate everything you say and going live on the radio.
Oh, that's great. That's really great.
From anywhere on the world, we can do it live.
And it would be translated?
It will be translated, yes.
Oh, that's perfect.
Y from Puerto Rico también se puede hacer.
Claro que sí.
Ah, pues, para allá me voy.
El mundo entero. You want to go to Puerto Rico.
Well, let's keep the conversation going, because it's going in the right direction.
Absolutely.
Thank you so much, Kevin. That means a lot. I'm so happy you've joined us. I know you've been busy, your sabbatical, and I wanted you so much to see how your recommendation for ORN 2 years ago, how it's planted a seed that's just growing into this wonderful garden. And Dr. Hector, with your hectic schedule and your own personal situations with COVID-19, and it's affecting everybody, and yet you always bring such joy and hope, esperanza, and I can't begin to tell you how much that's appreciated. And it just ignites las ganas, you know. It just makes me want to just go out and see what North Dakota is doing, what South Dakota doing.
Right. I think I got that from my grandma. My grandma used to say that you do what you can with what you have. And if I have the energy to do it now, I have the energy to give back to the community that have given me a lot. It's okay. It's okay. And if you find something you love to do and you help people, I think someone like Roberto Clemente say something like that. If you have the time to give back, and if you don't do it, if you have the time and you don't do it, something's wrong with this universe.
Wow.
So if we have the
You
time,
said that from day one at the conference.
yeah. So
And
if
you
we have the
followed
time,
through.
let's do it.
You follow through, and there's many people who say it, and then when you call them up, tú sabes. And so I just, from the bottom of my heart, gracias. I know you have patience, so you need to get going. But we're going to catch you again next month.
Of course.
Okay?
Always a pleasure.
Thank you. Nice
Gracias.
meeting you. Thank you so
Hector.
much.
Thank you so much.
Thank you.
Yeah, I think it's really great. I feel really great about this conversation. Yeah, and people are tuned into the live and stuff. And
Did you like what Kevin said about peer educators going to school?
Yeah,
turning that pain into something that
I got like the notes that I was like, that's it. Oh yeah, we mapped it out. But I feel really great about it. And what he Dr. Colon was talking about, just doing it, right? Like if you can do it, just do it. And I think that also, I got that from, because all the festivals and everything I've ever done was grassroots. Like we just did it. And I think that came from growing up with nothing. Poor makes you resourceful, right? So then you learn how to just, we're just gonna do it like that. Like, okay, I want to start painting. I want to be an artist. Okay, what? I don't have to paint on a canvas. I can just paint on something and then use house paints. Okay, use house paints. Boom, get a brush of whatever. You just do the thing. Like you just you figure it out. Like
and then, and just some wise words of wisdom is keep doing what you're doing. I mean, using art as that medium to bring the community and bring the stories. One of the mistakes of treatment centers is sort of putting a title of, do you want to get help get off drugs? I mean, that isn't an attractive per se invitation. That's why I'm saying the talent that you have, the approach you're taking, the closeness to the community, stay with that. And when people word of mouth find out that this is also about changing their life, word will travel, and it will travel fast.
You got it.
And it's through that trust. Yeah.
Yep.
Yeah.
And I may even, want to connect some dots with some other ideas for you, with some of the things that I knew I was working on with clues too. So
that'd be wonderful. Bobby and I were talking about Pancho and saying, why can't we bring him out to Minnesota? Let's get him into a class. Let's, give him that hope. Because I think we're more apt to do something for someone else than we are for ourselves. Latinos are like that. We're selfish.
Well, we're working on the first ever Spanish peer training to be happening later this fall or winter. So that's what I have in mind. And I think I don't think that's really the main invitation, because I think there's so much more on the table to do.
Yes,
there
is.
Absolutely. But but everything plays a great role, like a really, 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 really pivotal role. And one thing enhances the next. I'm crazy excited to get going on some stuff.
Right? The main thing is to know we're not alone. That just because we're from a small town that has no resources like your hometown in Texas, to connecting to some like a Minnesota who's rich in resources, who's rich in wanting to help. It's just that I don't know how, and how do I do this, and the reality is we're human. You just do it, and the language will figure itself out. Right. But that internal passion that we have, that internal commitment, like Kevin was just talking about, and how he shows. And already he's thinking about, connecting the dots. And for me, that's what it's all about. It's, what's the saying? You don't have to feed me, just teach me where the heck
Mhm.
the water is so I can go fish.
Mhm.
And
Yeah.
so
Yeah, I think you mixed about 3 of them in that one sentence.
oops.
I would take it. I
But
understood it like completely.
I did too. That's kind of how I work. Well, thank you. I want to thank you for inviting me.
Thank you.
Yeah.
May
Let's
we
stay in touch.
continue inviting you?
Of course, of
Okay.
course. Sounds good.
100%.
Great.
We're gonna stay in touch.
Great.
Definitely.
Thank you so
Okay.
much. And thank you,
Yeah.
Suzanne, very, 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 very much.
Yeah,
I
thank
see,
you for inviting me.
I see now that we have to like not
Oh,
do
yeah.
so much research as kind of do more action stuff. So we'll have that conversation later and
Yes, absolutely.
with Bobby.
Great idea.
But the main thing is to let them know they're not alone. We've
Mhm.
been waiting for you, Bobby. We've been waiting for you, Pancho. The reason you're walking through this fire is because it's greater than. And so hold on, porque it's a lot of wonderful things happening. And however we can help,
Mhm.
we're here. And I, again, want to thank you, Bobby. It's for inviting me to your casa. And, Puerto Ricans will stay. It's like, hey, where's dinner?
Yeah, it's all good.
And
This
to
is
your
great.
audience, thank you so much for supporting this incredible, groundbreaking work that's being done with Voces y Visiones and with Bobby Marines and his team. So, muchísimas gracias. And
Yeah.
we're going to be doing another conversation for Hispanic Heritage Month on the 15th. And then October 15th is the last day of Hispanic Heritage Month. So we're going to get together too. And then on November 2nd, Dr. Colon is going to, in partnership with Metropolitan State University, he's going to be doing his presentation on opioids and stimulants. So that'll be virtually headed up from Metro State University, and that'll be November 2nd for Dia de los Muertos. We want to celebrate, our ancestors are passing from this disease, and to just bring la esperanza and back into our communities. So thank you very much.
Thank you for being the one that brought us together. Like, yeah, that's really important. Like, really,
can't do it without my team. I mean,
I'm so
and you
excited.
know that you can't
I'm
do
so
it.
excited.
It's not a thing you do by yourself, and to be able to bring these experts to someone like you who's got the passion, las ganas, tú sabes, that's how it should be. And then however else we can help, you got us. So thank you to everyone, to your mom for always being there for you, to Alexa, who's an incredible woman, and I plan to do an article on her for Hispanic Heritage Month.
Yeah,
Because
that's gonna be great.
to, give our girls a Yahoo for everything they do. So thank you for everything. Y así que lo dejo. I pass it back to you.
All right, yeah, thank you everybody. Thank you. It was great meeting you, Susan. Thank you
That's
everybody
great
for tuning
meeting you
in.
too. Yes.
Feel free to share this. Also, we will be posting, feel free to send us, Carmen, if you want to send us the list of the dates for the next ones.
Yes.
We'll gladly share like a week before each one,
Wonderful. And I'd like to send everybody's contact information in case somebody wants to know who was that guy that was talking about the peer and who's that lady. We'll have that for you so that can be shared. And I think the more we call on them, the more they're going to be there. And of course, I want to thank ORN for sharing Dr. Hector Colon-Rivera with us. As you heard, he's been up since 6, goes to 7. And this is a constant thing with COVID-19. And his wife is also a physician, and she's a doctor on infections. And so she's an essential frontliner. And as you know, our health people have just been beaten up, and they're the ones that are going to keep us alive and healthy. And so our love to them, and be sure and say a thank you to whoever is out there doing anything. A thank you goes a long way.
Oh yeah.
So thank you, Bobby.
No, we're
And
just getting started. Thank you. I look forward to what's next. I'll talk to y'all soon.
I'll talk to you later.
Yeah,
Adios.
bye-bye.
Gracias. Adios.